I'm just going to present two ways that we can implement radical genuineness. One is what Marshall and Hand calls clinical irreverence. So probably the best way I can think of to describe this is when you speak truth to a client, but maybe not quite in a way that they were expecting. So there's a little bit of shock value here. One way of thinking of it is you're a little bit snarky, but in a good way for the client's benefit. There's many examples of this that I won't go into here, but maybe just reflect on times that you've maybe demonstrated irreverence with a client and didn't even know that there was an actual clinical term for that. And another way we can be radically genuine with a client is what's called functional validation. And that's just a fancy way of saying sometimes the most validating thing we can do for someone is to help them with what they need help with. So for example, if you're coming down a flight of stairs with a big pile of books and you trip and stumble and the books, fly everywhere, I could say, well, that looks embarrassing. Or I could simply help you pick up the books, right? Which of the two would be more validating, right? In some cases, you don't need the verbal validation. You need actual assistance. And we can do that in session too. So for example, if a client comes in and they're lamenting that they stayed up to 2 a.m. filling out job applications because they desperately need a job, because if they don't get a job, they'll be late on their payment again, and then they'll get evicted. You could just say, oh, that sounds so frustrating, or yeah, I remember a time when that happened to me, and okay, that's only going to go so far. What you could also do in that session is say, okay, we're going to take 10 minutes of the session right now to review your job applications. Or we've been learning interpersonal effectiveness. How about let's use 10 minutes of session time to call your landlord or draft an email, right? That's an example of functional validation.